Good morning, guys. Welcome back. So this morning I thought I'd go over a basic setup for a check and clean at the dentist. So let's have a look. Okay, so a few things we've got out. Okay, so this is your basic setup. Depending on the place that you work, it might be different, but let's get started. So let's have a look. First up, when we set up for a check and clean, this is what's on the dental assistant side. This is at my practice. It may be different at yours, but let's have a look. So we've got some Prophy paste here. This is what's used to polish up the teeth. We also have out a Prophy wheel. That's the little head here, and this clips on to what's called a slow speed handpiece, which is over here. So this is one of our clean packs. So everything is bagged at this practice. We take it out, we add a batch code. This is just a demo mode. We actually have a scanning system now. But so this tells you the date it was processed, the load, and the batch number, also who loaded it. There's an initial. But as I say, our new system has a scanning code. So this is just to show you. So this is the slow speed handpiece. This is what it kind of works as like the toothbrush head. But yeah, this is a slow speed. You can use it in restorative procedures, but it's in a cleaning pack to be used with a scaler tip. So this guy here clips into the slow speed. Your dentist may do that, or you might, just depends on what your practice's setup is. So next to this slow speed, we have the scaler tip and the adapter piece. So that's the ultrasonic. So this is the one, not sure if you can see, but there's a little tip. So that's the one that vibrates and shoots the water and helps get all the scale off the teeth. So we usually have this clicked into the chair. I will show you that in a moment. So slow speed, ultrasonic, Prophy paste, and Prophy wheel are what we've got out for our dentist to use. We also have some gauze. So we have one piece of gauze for the dentist. They like to use that to wipe their mirror of any debris. Make sure you have a second piece of gauze out for yourself. This is for patient care. So if they get any of the Prophy paste on their lips or anything like this, you can wipe them off at the end. We also have here, we have a bite wing. So I'll just use my tweezers. A bite wing is a radiograph used during a checkup and clean procedure to take routine x-rays of the mouth. It checks in between the teeth for any decay. It can also help show up any decalculus or scale, as I just said, that sticks to the teeth. And it's held by a bite tab. So these are usually on a roll. You just pull one off. They come in sets of two. They usually take 2 bite wings in a procedure. I've just got one out for a demonstration. We use the digital x-ray system in this practice. Sometimes you do a manual process. It's old-fashioned, but it still works really well. But yes, this one's quite easy for us nurses. We can just take them out and process. So that's an x-ray. Over here, we've got some floss. Obviously, the dentist uses that to floss in between the patient's teeth after clean to make sure we've got all the debris out. Sometimes they get the nurses to do it. Just depends on your practice. So we've also got some mouthwash here. So we give that to the patient. We put it on the patient's side. I like to leave it until the end just because in the past I've had patients ask if it's from the last person that was here. So I make sure I keep it on my side, or I put an empty cup on their side and let them watch me fill it up. At the end of the procedure, we ask them to have a rinse out. So I usually say, there's a cup to the side there, have a good rinse, try to get any of that gritty stuff out. And then when you're finished, I will give you the fluoride, which is the next one. Now, some patients say no, they don't want it, but that's fine. They can say no, but we always offer the fluoride. So it's a 30-second swish, then into the bowl, nothing to eat, drink or rinse for half an hour afterwards, just so it can absorb into the tissues and the teeth. It just helps harden the teeth. It's really healthy for the gums and teeth. So yeah, let's go through it again. So we've got Prophy paste, Prophy wheel, a bite wing. Now the bite wing x-rays also, I should add, are taken routinely every 2 to 3 years, or if the dentist sees something suspicious. So you don't take one every time. It's just dependent on when their last x-rays were taken. Some people don't want them, and that's fine, but always handy to check when your last x-rays were taken, or have your x-rays put out somewhere where they're not going to be in the contaminated zone, and you can grab them if need be. But that's what we've got out today. We've got the gauze ×2. We have our cleaning pack with a slow speed handpiece, ultrasonic adapter, and the scalar tip head. We've got our fluoride for at the end, and our mouthwash as well. So we also have over here our patient glasses, bib, and the clip. So when the patient comes in, you get them seated into the chair, you just say, here, I'll just pop it. I never say bib, actually. I say a drape in front of the patient. I'm going to put a drape on you. I don't know if, I just think telling your patient I'm putting a bib on you suggests something else. So it really doesn't matter. So I just say, here, I'll just put a drape on you. I give them the patient glasses. I say, here, just pop these ones on. And they do. Sometimes patients have their own safety glasses. They've just got to be wraparound. That's all. So if any splatter or contaminants got in their eye, they were protected. And it does happen. When the patient comes in, I like to make a point of using either the hand wash, which is over here, or the micro shield. I like to make a point of washing my hands while the patient's entering or getting seated, depending if you're bringing your patient in. So yeah, I hope that's helpful. We'll look at other setups, some other complicated ones. This is an easy one. Some other complicated ones, like setting up for a root canal procedure, can be a bit daunting when you're first starting. Or, you know, crown preparation, restorative, that kind of thing. We'll look at that more, but this is just a basic setup for your check and clean. I hope you found it helpful. If there's anything else you'd like to look at, we also do implants at this practice, so I can help you show you a setup for that if that's something the practice you work at does. But otherwise, yeah, I hope that was helpful, and I will see you in the next video. But otherwise, happy assisting, happy nursing, and I hope this was helpful. See ya!